where BinomLabs could create financial and R&D value for Teva. Teva spends $1.030 billion on research and development in 2025. Using our working assumptions that about 30% of relevant research and development is tied on in vitro workflows, that implies an addressable in vitro cost base of about $300 million annually. In BinomLabs proof of concept, we reduce the project pace from 10 experiments to 3, corresponding up to 70% reduction for in vitro experimental burden in that case. That was achieved using a well-established method that allows for 93% correlation between prediction and experimental data in biochemical laboratories. Implementing predictive methods into work processes will reduce the proportion of intermediate experiments and determine the direction of experimental research. The implementation of predictive methods is creating a framework for materially low experimental costs, more disciplined capital allocation in pharmaceutical research and development. If reproduced across applicable workflows, that implies a theoretical upper bound saving potential up to $212 million annually, of the $303 million spent on in vitro research. This is not another research tool, it's a potential capital efficiency layer for pharmaceutical research and development. There is also an important methodological point. The 93% BinomLabs forecast figure should not be interpreted as a direct saving rate. It's a measure of predictive alignment between calculated and experimental results in our presented in vitro case.